am Regine Mora. I go on all my platforms as Mommy Mango, and today I'm going to be talking a bit about mommy tummies, but with more emphasis, a little bit more emphasis on C-section, because I got that question on my YouTube channel. So I wanted to go over that just a little bit, but to get started, I want to talk about what happens to our core post-baby and why we should exercise in a way that's appropriate for really tightening up the core properly. I'm a mom of 4 kids, and I got into this because I was struggling myself, especially after my second kid, but even more after my 4th child. I was an exercise instructor. I ran an all-women's gym, Curves, for those who are old enough as like I am to remember something like that. But after my second baby, I was really at a loss as to why my core wasn't tightening. I was having leaking issues. I was having back pain. I was really struggling, and I guess the worst part for me was not knowing why the things that I had done before after baby number 1 to really strengthen my body wasn't working after babies 2, 3, and 4. Okay. So we're going to go over that just a little bit, because I always do that introduction, because I find that with new people on, there's always kind of an information gap. So I'm going to close that gap, and then we're going to talk a little bit about C-sections and answer any questions that you may have. So a lot of times when we think of the best exercises for our mommy tummy, we think of things like sit-ups, V-sits, things that are really heavy-duty core focus, and I would say they tend to lean towards focusing on the rectus abdominis, which is like the 6-pack. I think that happens because that's what we see. That's on the outside. That's what makes the little, washboard abs look. So we get really, I think a lot of the exercises that we find on YouTube, which is what I found on YouTube, were really focused on the external muscles of the core, the rectus abdominis, the external obliques, because that's what you kind of see through the skin, and that gives that kind of washboard abs look. So not that that is bad, but that's often not the most stretched out part of our core, and it's not the part of our core that really tightens us up and holds us in this way around the waist. Okay, so that's what we're going to talk a little bit about today. Because that was a problem that I ran into. I was doing all of these exercises that I thought were the appropriate core exercises, and I literally taught core exercise classes. When I was in graduate school, I was getting my a public health degree, a master's in health education. I was an aerobics instructor at the YMCA, and one of the classes that I taught and I was trained to do was core exercises, and I really never thought about moms and their core. So one thing that I want to start off this chat with is kind of a little exercise that you can do with me to kind of build some awareness. I want you to assess your tummy with me, whether you're standing or sitting. I want you to do a little something to kind of just see how your stomach is currently. So let's lean back. So we're going to lean back and we're going to look down. When you do that, do you see bulging coming up through your midline? So what I want you to do is lean back, look down. Do you see bulging coming up through your midline? If you see that, put yes in the comments. Where did I get this cool anatomy suit? I got it off of Amazon, but unfortunately I can't find it again. I really need a new one. Mine is super stretched out. Okay, so we're doing this quick test to see if you have a thing called diastasis recti. That's going to be the first thing I want us to just kind of check for, just so that you can have that awareness. I want you to lean back, look down. You can lean back as far as you feel like it. And if you see coning or doming coming up through your midline, I want you to put yes in the comments. I see 1 yes. I see a no from Sarah. Let me see. I recently learned I have an abdominal hernia. Okay, yeah, so that's not uncommon. Lots of ladies who go through my programs have abdominal hernias because of the stretching of that midline tissue or other connective tissues. And we can talk about that. Yes, so I see yes, yes, yes. I saw 1 no so far. Yes, yes, yes. Okay, here's another thing I want you to check for. I want you to lean back as far as you can, pretend like you're just kind of coming out of a sit-up. Can you keep your abs flat as you lean back, without actually touching the chair? Can you keep your abs flat? Or does your 6-pack bulge out? Does the whole thing bulge out? Say yes, or you can put no in the comments. And this might be easier for you to do on the floor. Get down into a sit sit. See how far you can come up while keeping your 6-pack muscles flat. Okay. If you see bulging, if you see your 6-pack bulge forward as you lean back, I want you to put yes in the comments. Okay. If you don't see that bulging, yes, it bulges. Yes, yes, yes. Okay, so I like to kind of bring that as ask that question to just try to raise awareness, because I think it's really important that we understand our trouble areas so that we can work on it properly. Okay, so the first thing that we checked for, and don't worry if you miss something that we're talking about, I post these to my YouTube by the next week. Okay. So if you missed that test, you can go back to my YouTube channel. You can find a lot of those like self-assessments. So that first test we did where we leaned back and we looked to see if we saw bulging at our midline, why that is the case, that is from pregnancy. Mostly from pregnancy. There are people who have come into my programs that have never been pregnant, but a similar issue really occurs with them, whether it's from weight or from other pressure management issues of the core. Okay, so what you're seeing when you lean back and you look down, you see that kind of bulging from the midsection. What happened during pregnancy is that your core really took a stretching, all right? So all the muscles of your core, but not only that, the connective tissue that connects the muscles together have also become stretched out. So this midline tissue, and that's very normal. So don't feel like, okay, something wrong with me, why did my body do that? Totally normal. In 100% of pregnancies that go through the third trimester, you're going to have stretching of the abdomen, you're going to have stretching of the connective tissues that connect the abdominal muscles together to allow for the baby to grow in the womb. This midline tissue here can go from looking something thin like this to something wider like this, or even wider like this. I've had moms come to me with like 6-finger width separation between the rectus abdominis muscles. So what happens is that midline tissue stretches out to help with accommodating the baby. So after pregnancy, 1 out of 3 of us will still have this stretching, and I'm one of those 3 people. This is why I discovered why I was struggling so hard to get my body strong again, was because in part I had this kind of major stretching with subsequent babies. The first baby, everything kind of tightened up pretty well, but after the second, third, and fourth baby I had, it wasn't so simple. So this midline tissue stretches, and that's called diastasis recti. Thanks so much for the hearts. This midline tissue stretches, and that's called diastasis recti. Diastasis means separation. Rectus refers to your rectus abdominis muscles. Okay, so when you lean back, you're kind of increasing the pressure in your abdomen. And what happens is that pressure is coming out through the weakest point. So right now, this area here, that stretched out tissue, is a bit weaker than it was before. So now you're seeing that stretched out tissue kind of bulge out as you lean back. So that's that bulging that you're seeing, okay? Is that. Now, if you're seeing just generalized bulging where when you lean back, you're seeing your rectus abdominis kind of pop up. You're seeing that pop up. You're not able to use your muscles to hold it flat. You're seeing that pop up. What you're seeing there is we would want more strengthening of the deeper core muscles. So let me just go through the different layers of abdominal muscles. So we have the rectus abdominis here, okay? Aw, Galleria 27, FYI, you are the reason why I'm back to the way I was before kids. Thank you. I'm so happy to hear that. Thank you so much for sharing that. That's the thing that keeps me going, because I struggle with this, so I totally get, how it feels to struggle, especially for me with the back pain, with the leaking. All of that is all connected, and having, looking pregnant when I wasn't, people actually saying like, "Are you pregnant?" I'm like, "No." So I experienced all those things. So anyway, I'm so happy to help. Okay. So with the, we're going through now what the different layers, the abdominal layers of the stomach do, okay? So you have your rectus abdominis on the top. That is a flexion muscle, so that's why you are able to sit up in bed. That helps you flex up. You have your obliques. They help you to kind of crisscross, okay? And then you have your transverse abdominis right under your internal obliques. That one actually wraps around your waistline and cinches you in this way. Okay, so if you're doing exercises that you're focusing on that flexion, you're not necessarily getting the muscle that actually tightens around your waist. You're focusing on the flexion muscle, the six-pack muscle, okay, which is not bad. It's just not necessarily getting that muscle that tightens around your waist. And that could be why when you do the sit-up, you're able to sit up, and you may see even your six-pack muscles like pop out, as far as like you'll see a lot of definition, but you will see that you can't keep it flat because that deeper core muscle, the transverse abdominis that wraps around your waist, cinches you in this way. You're noticing that that's not strong enough to keep your tummy in flat. Okay, and that's going to be a really important player when it comes to tightening up that mommy tummy. Not only that, but also very helpful for back issues and for pelvic floor issues as well, because it's all connected. Your transverse abdominis is very similar to a back support and tummy support. It literally wraps around you like this, okay? So if your transverse abdominis is loose, so let's pretend like it's loose here, it's just kind of floating along like that, all right? So even if your muscle, your rectus abdominis on top is nice and tight, when you lean back, this muscle is not strong enough to hold it in tight. It's like this. Not only that, but you might experience back pain because you don't have the good back support. If you wore let's say that you know you have back problems, you're going into work or doing whatever activities you're doing, and you put on a back brace, but you leave it loose, how helpful is that? It's not super helpful, right? So that's why it's important that we train and tighten our deep core support system. The transverse abdominis is part of that. And we want to get that nice and strong and tight so that it can give us the front support that we need, the back support, and it also gives pelvic floor support as well because it works along with the pelvic floor muscles. Okay, so that's a quick overview of the different parts of the abdominal wall. Okay, and so it's really important that we strengthen all of those muscles in balance with each other. And so it's kind of important to kind of assess, like, all right, which muscles are weak, which muscles are strong, and over time we can go through these things. I have a full course, I have exercises. By the way, I have free exercises on my TikTok. I have some full-length ones. If you're interested in full-length ones, I have them in the link in my bio. Those are free as well. I have a full paid program as well if you need something a little bit deeper, but definitely check out all my free stuff because I have a lot of it. Okay. So yes, now that we've gone through all of those different muscles, I'm going to go through really quickly to see if you have any questions that I might have missed. But then I'm going to talk just for a few minutes about C-section because I told somebody on my YouTube channel I was going to post some information about C-section specifically because that's an interesting topic that I don't hear a lot about, how you should approach that just a little bit differently so that you can really get the strengthening and help that you need with that, okay? Thanks so much for the hearts. I really appreciate that. I think it lets the algorithm know that we are talking about something substantial here. I'm not just here, dressing up weird and wearing this costume for no reason, Oh yes, let me go back to this hernia. Somebody asked about, or just mentioned that they have an abdominal hernia. So very quickly, what is a hernia and what difference can exercises make, and how is it related to diastasis recti? So I'm going to kind of like touch on that for just the next minute or so. A hernia, an umbilical hernia, occurs here at this midline. And when I was talking about having the stretching that occurs when you're pregnant, this area stretches out and it can become something like this, diastasis recti, being that stretching of the midline tissue. But a hernia occurs when you actually have a hole in the midline tissue. And they're kind of both, can be kind of caused by the same thing, but a hernia is more of a hole. And so when you do exercises that strengthens this tissue, whether it's stretched out or whether you have a hole, if that tissue around the hole gets stronger, then you can prevent the hernia from getting worse, so you can prevent future hernias. But the exercises that work that deep core muscle that I was talking about, the transverse abdominis, causes this tissue to get stronger. And that can prevent hernias, and that can also help to tighten up the hole that makes the hernia. So that tissue, remember, is a connective tissue. The hole is there in the connective tissue, but as you strengthen the connective tissue, that hole can get tighter, okay? Tighter, and it can not have the issues that you might have had before, all right? So that's just a little bit about hernia. And I have lots of ladies that have gone through my complete program with hernias. You just have to understand how to manage pressure properly so that you're not getting like that doming that we're talking about at the midline. That's not, you don't want to see excessive doming when you're doing exercises. So let's say that you have your favorite YouTuber or whoever that you follow, that may not be aware of these postpartum issues that I have, like on my YouTube channel. I'm super aware of that, so I try to make sure that all my exercises we are talking about how to make sure we're protecting our tummy while we're strengthening it. But let's say you have some other YouTuber that you follow and they're not really aware that we have that that situation. So one thing you want to look for is when you're doing an exercise, are you seeing excessive doming coming up through your midline? And by excessive, I mean when you touch it, is it very firm to the touch? Is it doming to the max that it can dome? If it's feeling super tight when it's like bulging out, like say you're doing sit-ups or V-sits or whatever it is, just make sure you're not getting excessive doming. If you get a little doming, it's not going to hurt. It's like a balloon. Like if you blow it up to the size the balloon was before, it's not going to cause it to stretch more. But if you blow it up to its max, and then try to blow it up even further, you stretch that balloon out. It's kind of like that with your connective tissue. So you just want to be aware when you're doing exercises that you're monitoring your body and you're paying attention to what's going on, and that you're aware, like, okay, do I see excessive doming that when I press it, it's really firm? If it is, you want to back off of that exercise a little bit and work up into that. Learn how to engage your deep core properly, because as you engage your deep core, that transverse abdominis, you can visually minimize that doming. I can do that like on command, but you have to have a deep core that's strong enough. You have to understand kind of how to do that. And I go into more depth of that in my courses. But I just wanted to kind of touch on that so you can have that tool in your toolbox to know like how to proceed from this talk when you go and do different exercises. Okay. Oh, Geneva, I need all the support for sure. Awesome. Definitely check out, like I said, I have a bunch of free exercises there in the link in my bio. So with the hernia, you really have to get an ultrasound to kind of see. Like sometimes the tissue, the midline, somebody is asking here, how do you know if you have a hernia? You want to get a scan to see for them to just kind of check and see if you have a hernia. Because what could happen is, like with me, I had diastasis recti coming out of my second, third, and fourth pregnancies, and that tissue at the midline can be so thin you might think you have a hernia because you can start seeing or feeling your intestines kind of bulge through just a tad. Nothing crazy, nothing like the Alien movie or anything like that where like the form is coming out of your body, but you might sense that you're feeling your organs and things on the inside. But that doesn't mean you have a hernia. It could just be the tissue super thin and stretched out at the midline. So you want to go into your healthcare provider and have them do a scan, and then they can tell you if you have a hernia or not. Some hernias are, really problematic. Some aren't. A lot of hernias you can live with and it's not an issue. They'll let you know, where you stand with that. Okay, so I want to very quickly go over some tips when it comes to C-section, because like I said, I promised a subscriber on my YouTube channel that I would discuss this, because I forget exactly what she was saying now. I wish I remembered what her exact question is, but I can go over some basics when it comes to C-section. Can I see like a hand or a yes, those who have had a C-section who are listening now? I would be really curious. And if you have any questions related to C-section, definitely drop it there in the comments so that I can make sure that I'm addressing. Okay, I see a hand, there's a hand there. So I have, okay, Bridget, I see you there. Yes, peace within chaos, yes. Okay, so I'm seeing some there. If you have any comments, concerns, or if you resonate with anything that I'm saying here, definitely drop it in the comments so that we can, I'm hoping that I answer the question that somebody asked on my YouTube. Okay, so with the C-section, that's major abdominal surgery. So you also want to always keep that in mind, that if you've had a C-section, the doctor had to cut through all of the layers to get to the baby. So it had to cut the abdominal layers, the abdominal wall, through all the muscles that I just went over, and then it has to cut through the uterus and then get the baby out, right? So that's major surgery. And when you have that kind of surgery, that can kind of shut down the muscles and kind of render them inactive until you kind of like really get back in touch with those muscles. Not only that, but during the healing process, scar tissue forms. And that scar tissue is amazing, because that's the body's way of healing. And your body takes those proteins and kind of just layers them across the scar to kind of get it all back together again. Now, with that, it can be a bit haphazard, and that scarring can prevent the nerves, the muscles, the connections that were there before. It can kind of mess around with that, okay? And so that's why a lot of you, and let me know if you identify with this, if you have a C-section scar, you might find that you get a little bit of a shelf, I call it, like right above it, a little bit of an overhang right above that scar, okay? It could be big, it could be small, but you get like just a little bit of it. It just seems like there's a divide there. Yes, okay. So, one thing I want to mention that's super critical for my C-section mamas, I have in my paid program, I have this whole section specifically for my C-section mamas, or any mom who's listening who had any kind of abdominal surgery. If you had any kind of anything, you could even have had tattoo in that area. That can affect how your muscles and nerves function. So this tip is for, I've had moms that have come into my programs that may not have had a C-section, but they had some kind of other kind of like abdominal surgery. I'm trying to think of any of that, appendicitis, like if they had any kind of thing where they had to enter into the stomach for any reason, there could be a very similar situation to having a C-section, because you have scarring, you have a cutting or something going in through the muscles, and it can kind of shut those muscles down. So one thing that's super important, and I have this in my paid program, but you can literally Google the stuff online or find other videos on YouTube, because I don't have one public on my YouTube channel, but you can find them, they're there. So even if you never come into any of my programs, it's totally fine. If you look up this one thing, and it's C-section massage, deep tissue massage on that tissue, because what happens is when you get a scar, the scar can kind of just bind down. So your muscles, your connective tissues, they are separate layers, because I just went over, we have rectus abdominis, external obliques, internal obliques, transverse abdominis, you have fascia or connective tissue. Those muscles and everything should really be, those layers should be able to glide over each other and move. And so what happens is when you get that cutting through the muscles and then the scar tissue that forms on top of it, sometimes those can bind down. That scar can bind down and kind of stick them all together, and they don't have that muscle movement that it used to have. And you might find that you might, over time, you might have some restriction, even a little restriction of movement. That area itself can feel kind of numb. Those things are things to really look for and begin to do those deep tissue massage massages to really help loosen that up, help those muscles, help the nerves, help everything kind of come back together and help them to be able to glide like they used to. I've had women who have come into my programs who literally were like, I've been doing the exercises and nothing was helping until I started doing the deep tissue massage to release that scar, and then the muscles and everything started coming together. They weren't getting the success that they wanted with their mommy tummy until they started that deep tissue massage. So this is like no gatekeeping right here. You can literally find these things, like look up C-section massage, maybe find a physical therapist or somebody. I have a physical therapist that works with the ladies in my program, but find a massage, a person who looks like they know what they're talking about, and follow along. See what you can do to kind of release that scar tissue. Okay. Yes. Okay. See, I hear someone saying it's painful. Are you saying like to massage it is painful or to touch it is painful? Start slow. Especially if you just had a baby, but even if you haven't had a baby in years, it can still be kind of painful. So when I say deep tissue massage, if it feels like some kind of way when you try to touch there, don't touch it yet. Touch around it. Massage around it. Get a little bit closer, every time you do it, and then just kind of go easy. Start very gently, and then kind of work your way up. You'll that area is really sensitized, so you'll desensitize it over time, and it'll get easier. But it's super important if you want to see success. I'm telling you, I've seen where before the massages, it has this line of demarcation in the shelf, and after the massages literally starts to smooth out, and the scar itself even starts to look better. So I promise you it's worth it. Just go easy and work your way up, okay? What if it's been 25 years? Doesn't matter. Now the scar can be tougher. You want to, you can start lightly, but as much as you can handle, go in deep, and really try to break up that scar tissue. Over time, it will get softer, okay? So it doesn't matter how long it's been, you definitely can still work on that. When I've done it, it feels like it's rubbing into my intestines. Is that a normal feeling? So you definitely just want to listen to your own body. It's hard for me to say because I'm not you, and I'm not wanting to give medical advice in this. If you are really uncomfortable and you're not sure if what you're doing is right, I would definitely say go see a pelvic floor physical therapist and have them put their hands on you and work with you, because they could just teach you in person, and then you could go home and continue doing it all on your own. Okay, so just want to be careful there. Okay. All right, you guys, if you have any questions, let me see, how long does the massages take to get back to normal? So it just depends. Everybody is so different. Like, one thing that the research shows is if you had a planned C-section, it's going to be very different than if you had a last-minute emergency C-section, because they were rushed and things may not have been done, the ideal way. They were just trying to make sure the mom and baby were okay. So I find with ladies in that situation, they may take longer. So there's so many different factors, and all of our bodies are so different. It's really hard to say. It's really just hard for me to say. Yeah, I still have numbness. I had a son 4 years ago. That's absolutely normal. If you haven't done deep tissue massage, then you're going to find that you could experience that numbness. I gave birth 18 months ago. Let's see, these days I have no stomach tension and I'm always short of breath. Yeah, so there could be, breathing, restoring the natural breathing pattern is actually a very crucial part of rehabbing our core, and that's a very critical part of my paid program. So yes, what you're saying, Kim, makes absolute sense, and it's not uncommon. You just actually sound super aware of your body, and you recognize that you're experiencing that. Some of us don't even recognize the changes that take place. So it's amazing that you become aware of that. And we can definitely work through that and get back to a place that feels right and comfortable, and we gain the function that we have oftentimes lost because of pregnancy. Yes, I have it, and some call it apron. I hate it. I know. All right, ladies, it's been such a pleasure. Definitely check out my free exercises in the links in my bio. I have all kinds of resources all over the place. Mommy Mango is the name I go by, since most people don't know how to spell Ration A. So it's a lot easier to spell Mommy Mango. Thank you so much. Next time I come on, which will be about the same time, Friday next week, we'll be talking about waist trainers and your natural waist trainer and binders and what's helpful and what's not so helpful. So that's what we'll be talking about next week. I hope to see you again. Bye.